Improving Patient Outcomes, a gestational diabetes education program for maternal child nurses. Hi, my name is Maria Milan, and I am a student at Excelsior College in the Masters for Nursing Education program. This capstone project journey has been full of ups and downs, but here I am, finally with my project completed. My capstone project was done at Good Samaritan Hospital Medical Center on Long Island, New York, focusing specifically in pregnant women's health with gestational diabetes, also known as GDM. My project title is, as I mentioned before, Improving Patient Outcomes, a gestational diabetes education program for maternal child nurses. I chose to focus on gestational diabetes because the problem I saw on my unit that there was only the basic level of knowledge of GDM and no focus on how to deal with gestational diabetes and the complications that entailed. For example, the cesarean section rates were high, as well as many of pregnant women were diagnosed with GDM and no education was given, leading to poor diet control and other adverse outcomes. That is when I saw a need that needed to be fulfilled. There was no gestational diabetes educational program in place that was geared to the maternal child nurses, leading to the creation of a gestational diabetes program. The way the project was conducted was by the creation of resources and tools, for instance, the PowerPoint, the pamphlet, meal plan, and blood sugar log. This was then presented to the maternal child nurses to help them understand that GDM is not just the understanding of the pathophysiological part, but what complications could occur and how to intervene, therefore passing along the education to the patients so they could manage it, and the importance of why they had to follow the education. After the nurses had received the educational training, they were tested again to see how much of their knowledge had increased, and they found out that even though the test was similar, the knowledge was not as they felt, more confident prior than the project was conducted. There are primary and secondary stakeholders that are identified in this project. The organization's maternal child registers, nurses, staff, and GDM patient population are the primary stakeholders. The secondary stakeholders in this project include the unit administration, which is the unit manager and the nurse educator, the diabetes educator, and the ultrasound technician. Other departments that are involved are the labor and delivery unit, postpartum, and antepartum unit. Stakeholders involved in the project came from different backgrounds, level of education, religion, culture, race, and socioeconomic status. This was put into consideration throughout the project because many of the GDM patients spoke a different language, did not have a higher level of education, and had a different culture. Therefore, it was important to value those differences and make sure the education and teaching was based on the patient's type of learning and reading style. Project implementation. The evidence-based research shows that proper and informative education to the GDM patients can help decrease future complications and risk factors throughout the pregnancy, as well as keeping the GDM controlled. Therefore, in order for this to happen, the maternal child nurses need to be properly educated. The nursing theory that connects with this project's Dorothea Oren's self-care theory. It is important for the nurses to guide and improve practice. Oren's theorem was used to help guide the nurses in educating the GDM patients on how to take better care of themselves by making lifestyle changes, as well as including the GDM management into their plan of care and active daily living. The leadership strategies that were involved were the importance of valuing the patient's beliefs, communicating with other team members, committing to excellence, and measuring what is important for the patients. This includes lifestyle, culture, habits, exercise, diet control, and understanding GDM. As a Hispanic nurse, I was able to promote the culture of safety throughout the organizational setting because I was able to explain to the maternal child nurses in a way of advocating for the Hispanic population, which which was most of the patients who had GDM at this organization. Outcomes were a decisive factor when putting this project together for maternal child nurses. They were important when forming a maternal child nurses educational program. Outcomes were geared in this project to obtain an increase in knowledge that were reflected in the competency taken by the maternal child nurses and the improvement of scores. Identified project outcomes stated that by the end of this project, the maternal child nurses will demonstrate increased knowledge in gestational diabetes as measures of increase of 10% pre and post test scores. The maternal child nurses will rate GDEP satisfaction above 80%. Maternal child nurses will be able to identify, locate, demonstrate competencies in use of the toolbox of resources to apply in patient education. The outcomes were all accomplished because the nurses' post scores were increased by more than 10%. The nurses rated the GDEP, which brought up the percentage above 80%. The nurses were able to identify and locate the competencies that were the tools and resources applied in the patient's education. Criteria were the pre and post test, educational pamphlet on gestational diabetes, the meal plan, blood sugar log for the patients. Significance was to decrease the complications that occur with these patients during labor and delivery due to poorly controlled gestational diabetes, and also to educate the nurses and how to properly educate the GDM patients at the early stage of pregnancy to reduce risk and complications. Nursing judgment was assessing the progress of these patients by monitoring their daily blood sugar logs, making sure the nurses are better informed and continuously educated on GDM. The advancement of technologies like ultrasound that can help accurately determine the baby's gestational weight, working with different professionals like the diabetes educator and labor and delivery nurses. The achievement of nursing judgment led to the desired outcomes, which were the nurses understanding their role in educating the GDM patients, and for them to control their diabetes better by logging their sugars, monitoring what they ate, and that all the questions and concerns were addressed for better outcomes. Signs and symptoms of GDM. Women with GDM tend to have either no symptoms or mild symptoms that are not life-threatening. Some of the symptoms are related to regular diabetes. That includes abnormal blood sugar levels, fatigue, excessive thirst, increased frequent urination. Although there are not too very little symptoms, it is important for the pregnant woman to monitor their blood sugar levels regularly and on schedule because elevated blood sugar levels can negatively impact the fetus. Patients. Macrosomia is when the fetus is weighing larger than the gestational age weight. This can be put the mother at increased chance for a C-section delivery. Shoulder dystocia. There could be a potential for death or brain damage due to the mother not being able to push out the shoulders with the next contraction after the delivery of the head. Neonatal hypoglycemia. It's long-term effect, neurologic injury that leads into mental retardation, development delay, personality disorders, repeated seizure activities, and impaired cardiovascular function. At birth, the baby will be having jitteriness, apnea, cyanosis, low blood temperature, lethargy, poor feeding, and poor body tone. The patient's interventions throughout the project was give the patients a log. That way they can keep track of their blood sugars and make sure the patients are controlling it appropriately. Developing a meal plan for the patients to follow. That way when they go grocery shopping, they know what foods are good versus what is bad. Informing the GDM patients with an educational pamphlet that explains what GDM is, what the complications are, how to monitor it, how it is diagnosed, and why the patients may have a C-section surgery. How were the nurses educated throughout the projects and how to educate their patients? Educating the patients that were not eating for two people, educating the patients how to check their blood sugars daily, educating the patients to keep a diary of what they were eating, educating what complications could occur during the pregnancy and labor and delivery stages, educate the patients are at risk for developing type 2 diabetes and postpartum period. Why it is important to educate the nurses? It is important to educate the nurses because if the nurses do not have the correct knowledge to educate their own patients on GDM, their patients may not be following their diets, controlling their gestational diabetes, and having more complications arise during pregnancies and labor. Therefore, with the appropriate amount of education, the patients may be more aware of what is happening and more willing to control the diabetes. The pamphlet that was used to give to the nurses so they could have a quick reference every time they educated the patients on why the importance of controlling the gestational diabetes, what were the consequences, and how this was affecting their unborn child in the process of not following the instructions that were given to them. Conclusion. Overall, the project was a success. I was able to innovate in a gestational diabetes education program for this organization. Gestational diabetes is a very serious and something that is not discussed or educated enough at the organization the capstone project was completed. Many pregnant women believe, oh, it will just go away after I am not pregnant anymore. Meanwhile, it can lead into type 2 diabetes and later complications related to blood pressures, cardiac, and renal issues. The underlying issue was that the patients were not understanding what GDM is and what the complications are, and this is where the gap was. The maternal child nurses were not focusing on gestational diabetes. The reason was there's been no annual education on it, in service or competencies, and therefore the project was done in this field, especially coming from a labor and delivery unit where there are always complications seen with GDM patients due to poor management. The overall outcome of the project was the nurses received their education and enhanced their knowledge on GDM.